and welcome to our Net Zero workshop in our series on transforming health services in line with the government priorities. So before we dive into the content today, I'd like to start off with some introductions. So as an organisation, we are Unity Insights, a social enterprise embedded within the NHS, having historically been part of one of the health innovation networks. We have a vast experience of working with healthcare professionals, innovators, and commissioners to support with NHS-specific challenges. Now, to introduce myself, my name is Harriet Lang. I'm experienced in a range of environmental and cost-benefit modelling techniques, and my areas of focus include evaluating diagnostic pathways, AI technology, and women's health, to name a few.
Hi everyone, I'm Lucy, an analyst on the team, and I have experience in conducting various mixed method evaluations and environmental analyses. Areas of focus for myself have included digital transformation, pathway transformation, patient safety, and population health.
Great. So to briefly cover off our expertise specifically in net zero, so we have experience in embedding the value of environmental reduction efforts into our real-world evaluations. We have also conducted a range of environmental analyses for different clients tailored to their specific needs, including complex life cycle analysis and carbon footprinting, in addition to incorporating those monetized carbon impacts within our health economic modeling where it's appropriate. And lastly, we always strive to incorporate this idea of holistic sustainability. And by this, we mean we don't only stop at those environmental considerations, but where relevant, we can also incorporate social aspects and economic considerations, as it's really important to consider all three of these when it comes to sustainable and long-lasting change. But we'll come back to this idea throughout the workshop. So as for our agenda today, as the focus of today's workshop is achieving net zero within the NHS, we will start off by covering what we mean by net zero within this context. We will then go through challenges relating to this topic, particularly in terms of data collection and evidencing those environmental impacts. We will then highlight how some of our previous work demonstrates impact with a couple of examples, before then moving on to outline how best you can go about evidencing your innovation's impact and achieving your environmental goals. Finally, we will then move on to any key takeaways, and we will then turn to answering any questions. So at this point, I'd like to encourage everyone on the workshop, if you have any question throughout the content of the workshop, please feel free to use the Q&A function within Microsoft Teams, and we promise to get to these questions at the end. Great, so I will now pass over to Lucy, who will discuss what we mean by net zero within the context of healthcare in the NHS.
Okay, so I'm sure you're all aware of what net zero is, but just to refresh your memory, net zero refers to an ideal state where the amount of greenhouse gases emitted equals the amount removed. Net zero can only be achieved if we know how large our emissions are, which requires measurement. There are various ways to measure environmental impacts, which we will discuss a little bit later on. Efforts are needed to reach net zero as it relies on a combination of reducing emissions and removing carbon through decarbonation efforts. This means either eliminating carbon emissions entirely or offsetting them by removing an equivalent amount of carbon from the atmosphere. According to the World Economic Forum, carbon removal is increasingly recognised as a critical component of reaching net zero. However, many of these approaches face challenges, including high costs and underdeveloped technology. Achieving net zero contributes to broader societal benefits, including equity, health, and resilience. It not only mitigates climate risks, but also addresses systemic social inequalities by reducing the disproportionate impacts of climate change. So one example of social value is climate justice, whereby in developing countries, despite contributing the least to global emissions, they face the worst effects of climate change, including extreme weather, food insecurity, and displacement. Therefore, net zero initiatives can promote fairness by addressing these disparities. So turning back to the question of when we should measure our environmental contribution, Well, the first question we can ask is, how can we measure our impacts and set up targets? Well, depending on your when and why net zero is necessary, you can measure your impacts with a range of different methodologies, which, as mentioned, we'll discuss a bit later on. Secondly, when is evidencing net zero needed? Well, governments and institutions are increasingly linking funding opportunities to sustainability targets, making the journey to net zero an essential priority for any organisation aiming to remain competitive and compliant. This slide illustrates a roadmap for suppliers created by Greener NHS and demonstrates the pace of change towards net zero. Only 2 years ago, there were no requirements around carbon reduction plans. Yet 3 years from now, all suppliers are required to share carbon reduction plans for all emissions and publicly report their targets. We'll go into a bit more detail around carbon reduction plans later. This acceleration in requirements underscores the importance of measuring and reducing environmental impacts. By aligning with these expectations now, organisations can not only meet current requirements, but also position themselves as leaders in a sustainable economy. This proactive approach could demonstrate readiness to adapt to future regulatory demands and strengthen stakeholder confidence. Our expertise can help with achieving the objectives set out by Greener NHS. There are numerous challenges involved in evidencing emissions and target setting, which we will explain later. In addition to NHS-specific requirements, it is evident that the new Labour government appears to be embedding sustainability across new policies and initiatives. One example is the Design for Life programme, which is an initiative of the Medical Technologies, otherwise known as MedTech, and Innovation Directorate in the Department of Health and Social Care, dedicated to delivery of a circular approach to MedTech. Circularity in medtech means designing, procuring, and processing medical products in a way that enables them to be reused, remanufactured, or recycled, preserving their value for as long as possible. The benefits of a circular economy in the health sector are vast, including improving NHS resilience, boosting UK growth, reducing waste and emissions, and generating cost savings. The vision is that by 2045, the UK will have transitioned away from all avoidable single-use medtech products towards a functioning circular system. So from a broader perspective, why else is net zero important? One, environmental impacts of healthcare. Healthcare contributes 4% of global greenhouse gas emissions, driven by energy use, medical waste, and supply chains. Without addressing emissions, the industry undermines its goal to do no harm by contributing to environmental health risks. 2. Resilience and sustainability. Net zero strategies can reduce healthcare systems' reliance on fossil fuels, making them more resilient to supply chain disruptions and rising energy costs. 3. Health benefits beyond emissions. Reducing emissions can result in improved patient outcomes. This could be through improved air quality, reducing respiratory and cardiovascular diseases, or through improved climate stabilisation, which could reduce heat-related or climate-induced disease outbreaks. Following the recent COP29 talk, a report was produced to highlight the critical link between climate change and health. It reiterates that health must not be sidelined or siloed in climate negotiations. It is the lived experience of climate change. The opening statement in the exec summary is, "Climate change is making us sick, and urgent action is a matter of life and death." And finally, as touched upon in the last slide, and perhaps most importantly, net zero is now essential in meeting policy and funding goals. Demonstrating net zero, or demonstrating the ambition to reach net zero, is a fundamental expectation in today's regulatory and funding landscape. So moving on to addressing the challenges. So there are several challenges with evidencing net zero. Firstly, skill sets. As suppliers and innovators are now required to submit net zero or carbon reduction plans, they may need support in this area, as it could be an unfamiliar domain where they have not yet acquired the necessary skills or experience. Secondly, data availability. Since this is a relatively new requirement for the sector, many innovators may not be gathering this data, particularly from their suppliers, and as a result may struggle to develop accurate carbon reduction plans. And lastly, decision-making. Commissioners will need to make decisions that consider financial, patient, and environmental perspectives, and this could be challenging without a unified approach. So just touching upon those three factors. So society, economic, and environmental factors all need to be considered to make sustainable change. And this is known as the triple bottom line. So some considerations around this concept include how do you weigh up environmental benefits, patient benefits, social benefits, and financial positions? How do you ensure minimising environmental impact of the NHS does not compromise the quality of healthcare? And how do you improve access to healthcare whilst also reducing cost and emissions? Well, these considerations highlight the complexity of balancing these three elements, particularly when factoring in patient and societal outcomes, which subsequently creates challenging decisions for commissioners and innovators. Our approach can integrate all three perspectives into our measurement framework. Evaluations enable a deeper understanding of their combined impact, guide decision-making, and foster the spread and adoption of innovations.
Great. So now we understand the concept and importance of evidencing net zero within the context of addressing some of the challenges around this. We can start to consider how do we go about demonstrating the potential impacts of healthcare organizations and their products on the environment. So to serve as an overview of the various sustainability analysis tools, you can see on this slide that there are many and they all offer something a bit different. Now, we understand that everyone has different needs to evidence their efforts towards net zero. And this begs the question of how best to measure our impacts and set targets. Now, again, depending on your needs, you may require a simple measurement or perhaps a more complex analysis because you want to understand more of the key drivers of your emissions and delve a bit deeper as to, where are those hotspots coming from. Now, we will cover a range of measurement approaches that we commonly use, and we typically recommend three main approaches for most NHS partners and innovators, namely environmental impact assessment, carbon footprint, and life cycle analysis. Now, we will go into more detail as to why we prefer these three, but this is mainly because they allow for consideration of multiple different impacts and can be conducted either pre or post implementation of a solution to ultimately provide insight at different stages of the project where it is best needed. Now you can see on this slide, I've noted down some of the key considerations and questions that you may need to ask at the start of your journey towards evidencing net zero, which will be good to keep in mind as we go through some of these examples together. So I will now hand back to Lucy to share how to conduct a carbon footprint analysis with specific reference to carbon reduction plans.
Okay, so firstly, to touch upon what a carbon footprint is. So a carbon footprint analysis quantifies the total greenhouse gas emissions associated with a product, process, organisation or activity over a defined period. It is measured in units of carbon dioxide equivalents, and by using this unit, it allows greenhouse gases such as methane and nitrous oxide to be standardised according to their global warming potentials, providing an accurate representation of their relative impact on climate change. There are several purposes to a carbon footprint analysis. Firstly, to assess the environmental impact and understand the contribution of specific activities or entities to climate change. Two, to pinpoint areas of significant emissions, so i.e. hotspots for targeted reductions. Thirdly, to develop actionable sustainability goals, so help with strategic planning. Fourth, to align with regulations and reporting standards, and therefore to be compliant. And lastly, to share sustainability progress with stakeholders. So I've already mentioned carbon reduction plan quite a few times already in this presentation. And just to describe a bit more about what it is and the methodology. So all NHS procurements must now complete a carbon reduction plan, and there are several key components to carbon reduction plans. So firstly, we're expected to confirm commitment to net zero by 2050. We also need to identify and calculate our emissions. We need to set reduction targets and outline initiatives, both completed and planned initiatives. And then that needs to all be approved by the board of your organisation and published on the website. And it is this step of identifying and calculating emissions whereby carbon footprint analysis is necessary. So to calculate our emissions effectively, we need to start firstly by identifying relevant emission streams and organising them according to the Greenhouse Gas Protocol standards. So this means categorising them as either Scope 1, Scope 2 or Scope 3 emissions. So just to run through what those are, so Scope 1 is direct greenhouse gas emissions, and this refers to emissions from sources directly owned or controlled by the organisation. So that might be fuel combustion on site, for example. Scope 2 refers to indirect electricity emissions, and they're emissions from purchased electricity supplied by utility providers. And finally, Scope 3 refers to all other indirect emissions. There are currently 5 mandated categories for carbon reduction plans, and these include upstream transportation, waste generated in operations, business travel, employee commuting, and downstream transportation and distribution. So once these emission streams relevant to your organisation are identified, you can utilise existing data or collect new data based on the metrics aligned with equations that you can find in the Greenhouse Gas Protocol, and then you can convert these to CO2 equivalents using emission factors. So most commonly in the UK, we use the government conversion factors. So I'll just run through an example of one emission stream, and on this slide we're looking at employee commuting. Here we use the distance-based method, which we deemed was the most appropriate method for our organisation, but in the protocol guidelines you can find other methods which might suit your organisation better, so for example the fuel-based method. Once we identified the most appropriate method for us, we collected some data. So for employee commuting, you had to collect data for each transport mode. So for example, cars, buses, and trains. And we gathered information on the distance that employees travelled daily between their homes and work sites, the number of commuting days in a year, and a bit more information on the specific mode of transport. So for example, for cars, we wanted to identify whether they were petrol or diesel and whether they were small, medium or large, as this influenced the emission factor that was used. So we collected this data through a data collection form that we created in-house, but it could also have been done through methods such as employee surveys, commuting logs, or other tracking mechanisms. And as mentioned previously, once we had the data for each transport mode, we plugged it into the equation, which you can see there on the slide. And so we ended up with an emission stream for each mode of transport. So emissions for trains, emissions for buses, emissions for cars. And these were summed to get the total emissions for employee commuting. So that was a really quick insight into carbon footprint analysis. And next we'll explore another method of measuring environmental impacts in the form of a life cycle analysis.
Great. Thanks, Lucy. So many of you may be vaguely familiar with carbon footprinting, but there are more nuanced ways that can generate more valuable sustainability insights for you. And LCA allows for this broader sustainability analysis very well. So what is a life cycle analysis or an LCA? Well, put simply, an LCA evaluates the environmental impact of a product or service across its entire life cycle. And this is typically from the point where raw materials are initially extracted all the way until the product or service is ultimately disposed of or decommissioned. So another way of looking at this is that a life cycle assessment quantifies a large number of resource uses, substance flows, and environmental accumulations. Now, the purpose of using this methodology is to account for environmental impacts on a larger scale. So thinking about this broader picture, where we think about what are some of the supply chains that feed into our product or service, and what are some of the ripple effects that may come about as a result. So this avoids erroneous claims that there might be local or micro improvements at the cost of the broader picture. Now, LCA is also a standardized methodology, which is conducted according to internationally accepted LCA methods outlined in the ISO guidelines on the slide. LCA is distinguishable from other environmental methodologies, which evaluate environmental impacts, mainly because other methodologies will quantify these impacts in terms of that product or service, whereas LCA focuses more on the function of the product and therefore expresses the impacts in terms of that functional unit. LCA also allows for social elements to be incorporated into the analysis. And this brings us on to how we embed sustainability. As we mentioned a few times earlier in this workshop, it's really important to embed sustainability considerations. And you can see that on this slide, one of the best ways to do this is to incorporate all three considerations into what is known as a hybrid life cycle sustainability analysis. Now, this incorporates three independent LCA models. So these are sort of permutations of this traditional LCA. And as we discussed, a traditional LCA only looks at environmental impacts. So that's one option. The second is the social life cycle analysis, which specifically looks at those social impacts. And then thirdly, we have the life cycle costing model, which looks at these economic considerations. And only by considering these three pillars of sustainability can we ultimately develop products that will be sustainable and ensure this for all the activities going forward. Great. So as I've described, LCA does pretty much have the potential to account for all supply chains and ripple effects of a change in the system. But of course, within time and budget constraints, this is not feasible. So for all LCAs, it is required that a system boundary be transparently outlined. And by system boundary, we essentially mean, where do we draw the line? Now, there are traditionally two options here. The first is known as cradle to gate, and this encapsulates the first three phases of the life cycle, namely raw material extraction, which can include impacts from farming or mining activities. Secondly, we have transport. And thirdly, manufacturing. And this can involve activities such as thermoforming of plastic components. So ultimately, the scope of cradle to gate focuses on developing a product to get it ready to use, but it negates all of the impacts that may arise from a user interacting with the product. However, the second option in terms of scope, this cradle to gate consideration, this encapsulates all five phases of the life cycle. So it will include any utilization impacts, and a common example here might be the electricity used when interacting with the product. And then finally, that last life cycle phase, which is disposal and recycling. So now moving on to an example, as this is often easier to explain a concept, we're going to utilize how we can employ LCA in practice. And this AI example that I'm going to cover now is a really good one because it basically shows how you can start off with quite a simple environmental impact analysis. And based on those initial findings, you can then win bigger pieces of work where you can then evidence more complex analysis through way of life cycle analysis. So as some broader context, approximately 6 million CT scans are conducted per year within the NHS. And it has been estimated that half of these use injected contrast agents to distinguish different types of soft tissues. Now, the example we're going to focus on here is an AI solution which provided an alternative option for contrast enhancing these CT scan images, basically through using an AI algorithm, thereby eliminating the need for these contrast injections altogether and all the single-use consumables that are associated with those injections. This may potentially reduce the impacts of the diagnostic procedure. So as I mentioned, in the first instance, we were commissioned to evaluate the environmental impact of this solution. And an environmental impact assessment was the most suitable option here because the solution was pre-implementation and funding was limited. So as you can see on the next slide, using this environmental impact assessment framework, we looked into multiple different impacts. As you can see, they were quite a range, from electricity usage all the way to considerations around aquatic impacts. Now, as this was early stage, some of these impacts we were able to model, namely the reduction in the consumables that I mentioned previously, and the reduction in the iodinated contrast media itself. and electricity impacts pertaining to data processing and CT scanning. But some were left unmodeled and suggested for future research. Now, the impact of these early findings that we could determine with an environmental impact assessment led to a larger European bid that was won. So following from the small piece of work where we had a hint of where the environmental impacts may be coming from and had an early figure attached to this, we continued to work closely with the innovators to develop a life cycle analysis. So you can see here, I've just included a high-level difference between the baseline and the AI solution here. And by baseline, in this context, we're referring to the status quo or business as usual, where those contrast injections were used on patients. So you can see in the top pathway there, we've got our life cycle stages, and we've just briefly highlighted where we found that most of the emissions and impacts were coming from. So it was from the manufacturing and the utilization of these consumables related to the injections. In contrast, we can look at the AI solution pathway overview and see that although they didn't need those contrast injections or any of the consumables there were these additional impacts relating to cloud infrastructure that would need to be set up because these AI algorithms would need to be run for each CT scan to contrast the scans digitally. And again, these are both coming mainly from the manufacturing and utilization phase. So I hope that this shows a good example of where you can have a different range of your environmental insights, and ultimately this will depend on your needs. But an LCA will ultimately show more of those nuances and provide that hotspot analysis where you can delve deeper into understanding where your impacts are coming from. Now, as we are still in the process of working on this project, we cannot share our results yet, but for illustration purposes, we've included a couple of examples in this slide. So on the left, you can see that using SEMA Pro as our modeling software, we can set up an entire lifecycle process tree for both the baseline and the AI solution pathway. And this will range with impacts from the system level all the way down to those raw materials. And ultimately, once we've mapped this out and set up all of the impacts, we will generate an impact that can be mapped to various different categories. So on the slide, we've just included the human health impact, and you can see that the darker bar on the bar chart indicates much larger impacts compared to the lighter green bar. So that was just, again, a very quick snapshot into some of the modeling approaches that we have used at Unity Insights, and I hope that that has been very interesting for you. But now to move on to some of the key takeaways. Circling back to, based on all these different methods, how do you choose the best analytical tool? And as a key takeaway for all of you on the workshop today, some bits to keep in mind. So if your change that you're wishing to evidence its commitment to net zero is a new localized activity that's at its pre-implementation stage, an environmental impact analysis may be best for you as it will provide those early results and recommendations and can incorporate variable impacts. However, if you're looking to come up with a carbon dioxide equivalent figure and you might be needing to use it for a carbon reduction plan, a carbon footprint may be best to evidence your commitment to net zero at the individual, organization, or product level. And finally, if you're looking to investigate an entire life cycle and look into some of those more detailed supply chains, a life cycle analysis may be best suited as it can incorporate multiple different impacts, provide very in-depth hotspot analysis, and is best for embedding those sustainability considerations, such as those social aspects. Finally, then, just some few key takeaways in addition to understanding the differences between those tools. So firstly, determining your impact on the environment has never been more important. And I think our research today and key examples have shown that, and most especially our second key takeaway, the fact that the NHS has mandated that all organisations must publicly commit to the NHS net zero goals by 2027 encapsulates this very well. Thirdly, embedding the triple bottom line is key to sustainability and ensuring that any efforts we make towards environmental reductions are going to be longer lasting and sustainable changes because they consider social and financial considerations as well. And then finally, it's really important to consider how best to evidence your environmental efforts. And this will vary based on what you hope to achieve in the coming years in your commitment to net zero, and also budget considerations, of course. So that brings us to the end of the content for our workshop today, and we will now turn to see if there have been any questions throughout the workshop. Okay, so I'm not seeing any questions coming through just yet. I'll give it a few minutes, but I may pass over to Lucy at this point to direct us towards any next steps following this workshop, especially if you found it was useful in improving your understanding of net zero in the NHS. But perhaps it does leave you with some questions, which may not be in the Q&A function just yet, but you may want to contact us following this.
Yeah, so as Harriet said, we really hope that you've enjoyed this workshop. This is the 6th workshop in a series, so I just wanted to show you the full list of subjects, some of which we've covered already, which you can find on our YouTube channel, which we'll pop the link in the chat for. And I think we've got 2 or 3 more after this one. So if this workshop has piqued your interest, yep, you can go back to the recordings, and we'll pop those links in the chat. Okay, so we have reached the end of today's presentation. If you do have any questions which you don't want to ask here, or you would like to get in touch with us in the future, there are a range of options for you, which you can see on the slide. We've got our website, our Eventbrite page, LinkedIn, or you can also book a one-to-one meeting with our team. So on behalf of myself and Harriet, we'd like to just say a really big thank you for your time today, and we look forward to continuing the conversation with you in the future.